okay? Because we're trying to get the shoulders as low as possible. Our centering for almost everything cervical is C4, so just have to do a little
Where would C4 be?
changing,
Like, how would you
tweaking.
know?
It's at your thyroid cartilage. C1, and basically, we're saying is right at the mastoid tip. C3 is here, so that should be pretty decent for C4. I'm sorry, my hands are cold.
So kind of like jawline.
I'm so sorry. Yep, gonion here, so yeah. I mean, depending on how, because some people can hold their head up, but it's right about at the top of the thyroid cartilage there, so. Yeah, that's all you're looking at. So this I always try to put like right in the crease. I obviously want it out of the way of the spine itself, my marker, but so I always look to see here. I'm not going to put it that low on her, but I could where you're seeing it's right in the area, but if I put it there, it'll be okay as well. But I do like looking at that and saying, okay, I've got my open area here and getting it in place, so it does make it easy. And you always want to make sure that they have their chin raised, not like extended, but just raised, so the gonions are not present over top of the cervical spine. And that's what you're trying to clear there.
So how open should your collimation be from top to bottom?
Top to bottom, if I'm literally at top of ear, so you can see I can collimate down some. So I want to be,
Top of ear.
yeah, I don't want to be any higher than top of ear, and I want to be through C7, so I've got that covered, so.
Where would C7 is vertebral prominence?
Vertebral prominence
Okay.
is at the level of T1, so I have my C7 T1 articulation that I want, and hopefully if Kayla breathes out and reaches down towards her toes and literally is pulling, this will feel, can you feel the pressure
Yeah,
when you're
definitely.
pulling? And so you'll feel the pressure when you're doing this as a patient, okay? So don't make them do it forever. And you go out here, take a deep breath in, blow it out, expose.
And this
Okay.
one's 85 at 7.
Yeah, for, it can be 85 to 90 at 7.5.
Okay.
85 should be fine for Kayla. Then the next thing we're going to do, since I already have her in a lateral position, is I'm going to go ahead and show you the flexion and extension. Okay? Obviously, patient's still in the lateral projection. The only thing we're going to do differently with them is the position of their head, which will change the position and neck. So I'm going to take your head and bend it forward. Okay? And what I like to do, because I just think that it looks nice, is take it and orient my tube head to the spine, so it stays in line with the spine, okay? And that's our flexion. You can have markers that say flexion, but you're going to know that you have your flexion. Technique doesn't change, it's stop breathing. Okay, stop breathing, hold still. Extension, all you're gonna do this time is take your head and bend it back as much as you can.
So it doesn't matter if you're on inspiration or expiration, it just stop breathing.
Yeah, you can do it on expiration, but it's honestly, stop
Doesn't make a
breathing
difference, okay.
is going to do the trick. And again, just stop breathing, hold still, relax. Feel better?
Yep.
Now, I will tell you one thing, when you start to do extension flexion, people generally won't feel it, but when you start to do extension, I would say make sure you get back to your patient and then have them bring their head back forward, because if anybody's going to feel vertigo, they're going to feel vertigo when they come back from that extension. So just kind of hand on shoulder and have them come up and just pay attention to that. So.
Really bad.
Yeah, and I don't know why, but I mean, if they have an injury, I'm assuming that that's what's causing that sensation, but it's just, especially the older people get, the more chance that's gonna happen, so it's just a thing to pay attention to. All right, and then we also know we're going to do our swimmers. We'll do that at 72, And for our swimmers, we go ahead and bring this arm up.
Inflection
in
and
there.
extension are 72.
Yep.
Nothing changes, okay.
I'm gonna pull this one down, kind of like you're, without twisting, but like you're reaching down. And for this, two different things. If you have somebody that has a thick neck, you can always put a slight angle. When I say slight angle, it should never be more than like a 5-degree angle. But you could put that slight angle on it. I don't overly feel the need to do it for Kayla, but you can, and generally when you do that, you'll see, you throw that 5-degree on it. Here. And you're gonna be aiming right at the C7, T1 articulation.
Would you still
okay?
need light field above the ear?
No,
Okay.
nope, long as I have C1, I'm sorry. my
I
hands
know,
are
it's
so cold and
my
I'm
hands are
freezing
so
her
cold, too.
and I apologize. And what you don't want is people are going, oh, they wanna lean their head.
Mhm.
You don't want them to lean their head. Obviously, you want the neck to stay straight. So that's what you would do there for the swimmers. Go ahead and turn
And
around.
when would you do swimmers? If it was requested?
If you did not know, if you go and you do your lateral C-spine and you cannot see the space between C7 and T1, you have
Then
to
you have
do
to
a
do swimmers.
swimmers.
Okay.
So you're going to be the one who's going to be deciding, do I
Got
have,
it,
well, I mean,
okay.
not as a student, but you should be able to look at it and go, oops.
Can't see
not
it
there.
and then do
So
it.
I have to do it, yeah.
And then on our comps, you'll just tell us like, oh, you
Mhm.
can't see this, and then we'll have to know to do that. Okay.
Yep, yeah.
So
Yeah, cause like
swimmers
someone like,
and Fuchs is if you can't see the.
Fuchs is if you don't see the tip of the odontoid process. Okay, so that's everything that we would do at 72, okay? Well, one of the nice things is, we'll see if you're tall enough that I can do this. On your axial, you're going to do between 15 and 20. If the patient is laying down, you would do a 15-degree angle. And at most sites, they're just going to go ahead and have you do a 15-degree angle on your AP axial. But for the erect, we truly should be throwing on a 20-degree angle because of the articulation of the spine in the erect position, okay? So that 20-degree angle opens everything up in the vertebral column as it should be, standing 20 degrees, laying 15. Okay, so testing, you always have to know. It'll give you, oh, if we're doing an AP axial, what does the angle need to be? And then you give the range. You can say 15 to 20 degrees. If it specifically says erect, it
20.
needs to be the 20. If it's specifically supine, it's 15. Okay?
I'm gonna
Yeah.
ask you a question.
Go ahead.
Just when we're done. I don't want to get.
Oh, okay. Yeah, no, well, you know I can't walk and chew gum. So you gotta make sure that you're asking me at specific times. Step just like just a hair, cause I know I'm not gonna be in alignment here, so a little bit more, sorry. Just cause it's stupid tube, which you guys don't have to put up with out on rotation, right? You don't have tubes that are that bad. And again, C4 is what we're going for, okay? So, do I literally care if I have perfection? Honest to God, no, I don't. I just wanna make sure that I'm getting everything I need. You know, for your testing purposes, that's what you wanna be looking at. I'm gonna make sure what my marker is and
Where do you say C1 would be again?
C1
Right
should
there,
be,
okay.
right, it's field, well, yeah, can you feel the mastoid tip? I go,
On here,
mastoid
yeah.
tip right here
it's
behind your
C1.
ear, that's at the level of C1.
Okay.
And if you were using a visualization without trying to touch, it's EAM here, it should be about an inch below. I don't really think it really feels like it's an inch
And
below.
then
but
the T-bar common, and this is T1.
Yep, T1.
So it's
Yep.
from here to here, which is really small.
And now when we're doing the cervical, normally it's typical because we're not seeing C1, C2, we're supposed to be seeing C3, and usually we'll go between C3 and T3. So we are visualizing some of the thoracic spine as well
Okay.
with our AP axial, okay? So this, again, all we're telling them, stop breathing, hold still, okay? That's it. So I don't care where they are in their respiration process, I just want them to stop.
Okay.
So we're not getting any motion. So that's your AP axial. Now, next we'll go ahead and we'll go to putting our tube straight on, and we'll go to our open mouth. First thing I'm gonna do, try to make this
I did this
really
one before.
small. And then I'm gonna say, watch your eyes. I don't think I'm gonna get it in your eyes because I've got it small, but yeah. I didn't figure I would, but you know, warn them. Okay, now here, this becomes important, okay? Base of skull, all right? And if you wanna come, so you're getting a side view here, base of skull. Mastoid tip. I want these to make a straight line. So I'm gonna tilt Kayla's head forward just a little bit because I want a straight line there. And then I'm going to look at this line and go to the base of the upper incisors, which base of the top teeth, okay? And then I'm gonna tell Kayla, drop your jaw. Close your mouth again. I'm gonna tell you to do it again. Yeah, but I just want you to drop your jaw. I don't want you to open your mouth real wide. I want you to drop the jaw. A little more. There we go. A little more. Okay. The reason why I say to drop your jaw is because when you tell a patient to open their mouth, they do exactly what Kayla did, which is, and you know, the mouth goes wide, they raise their head up, so now they're out of position, right?
They made me
So
open
that's
my
not
mouth.
what we want. We want them just to drop the jaw because we want the mouth open, but if they just drop the jaw, you shouldn't have to reposition. Okay? So, let's look. She's like, yeah, I'm all out of position now. All right, and so, mastoid tip, base of upper incisor. So line right here and base of skull should be in the same line. So this should make a line be perpendicular to
Okay,
Kayar.
tilted.
Don't make her laugh, okay?
I'm
And-
looking in the reflection here now.
Okay.
Ridiculous.
And no gum in mouth, no piercings of the tongue, nothing like that
No, I don't
can
have that.
be in there, okay? So, and I want my CR right there at the open mouth. I can pull that down, although it's not gonna make a darn bit of difference. And I again would tell her, stop breathing and expose. And she's gonna wobble, close your mouth. She's gonna wobble, wobble, wobble there, and it's not fun, but, so, last thing you want them to do before you go to expose is to drop the jaw, okay? So we're not gonna have them do that ahead of time. So this week, one of the main things you're gonna be paying attention to when you're prepping your patient, because basically neck up is what we're worried about, right? So female patients, bras need to be removed because they have those darn little things that are on the straps to
Adjusters.
adjust the straps, they show up. So a lot of places will tell you, just tell them to drop their bra strap. We're gonna tell them they're gonna remove it because that's best plan. Jewelry needs to be removed. Necklaces need to be gone. We always have to ask about tongue piercings, and we have to ask them, Do you have any candy or gum in your mouth? If so, spit it out, because gum especially looks really, really, really like a tumor. Okay? So we don't want gum in their mouth. Most of the time when we see it, we're automatically going to assume it's gum, but that's
Earrings have to come off
big
too,
no-no.
right?
Earrings come out, yep, everything, neck up, jewelry-wise. Hair barrettes have to come out. If they have a weave, you need to know they have a weave. Okay, because nobody's gonna take a weave out for me, right? But I need to be able to put that into the notes so that the radiologist knows that they do, because they're gonna see it in the image, okay? Wet hair, not our friend. So if we can get it up on top of the head for the majority of the views, works for us. The hair bands that have the little tiny piece of metal on them, that little piece of metal shows up. Barrettes, bobby pins, all that. So you're really going to check if they have a weave and a wig. The wig, if we can get them to take it off, that would be cool. A lot of people aren't going to take a wig off, just like they wouldn't take their weave out, because it's it's a personal thing. So you got to be careful the way you're asking people stuff. Dentures, preferable to be removed. Will people always take dentures out? So much of the time, the answer to that is no. Okay, so don't feel comfortable with it. I literally had a lady cry because I was asking her to take her dentures out. She said, oh no, it was terrible. And like, to me, it wasn't a big deal. Okay, I guess because I don't have dentures and I didn't need to take them out. To her, it was a huge big deal and it was very humiliating. So I was like, well, I don't necessarily have to have them out, but I will get a lot better image if they're out. So if you can talk them into taking them out, cool. If you can't, make sure you take a note that they're in there, okay? The little girls or whatever that get popped on over the teeth, they're going to cause a problem. All these things will cause problems for us. So anything that is removable, we want gone. So our history kind of changes a little bit now, right? Or our patient prep kind of changes a little bit. So we have to be that much more conscious of all the things that they could have. Cheyenne chewing gum, this one chewing gum, so yeah, so we have to, we need, because the bottom line is we need to know the ones that are young enough to not have dentures, we got to worry about tongue rings and stuff. So yeah, there's no winning. Nipple piercings.
Even young people, some young people can have like fake teeth that they go off,
So we just, you just can't, it's nothing you can assume by age. So we just kind of have to run through the whole gamut for everybody, And hey, if you're 90 years old, I'm asking you about tongue ring and stuff like that, and then I get to dentures. Dentures doesn't seem so bad by the time I get to it, right? Okay, so just think about that kind of stuff. So it does matter, and people are going to be really sensitive about it, but you need to make sure that you know all that, because